This week on the Physio Foundations podcast, I'm talking to the program director at Torrens University in Melbourne, a tendinopathy researcher and rehab specialist, Tim Trevail, and we're going to talk about finding your purpose as a health professional. Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So my guest today, Tim Trevail, is all over the internet. And if you want an introduction to him, well, we'll ask him to do an introduction in a moment, so you can listen to that. But if you Google the man, you're going to find him everywhere. He's quite a prolific social media user and disseminator of research. And that's actually how we met. And since then, we've been working together at Monash University in the Monash Musculoskeletal Research Unit, and have been to a conference recently together, the Sports Medicine Australia National Conference. So I've got to know Tim a lot better through there. And I think you're going to really enjoy this conversation. Tim's a really engaging speaker. He's done quite a lot, as I've mentioned, in terms of engagement online, and in education. And of course, he's heavily involved in health profession education. So let's bring him on. Tim Trevail, welcome to Physio Foundations.
Thanks very much, Luke. It's good to be back on here. I think it was a little while ago I was last here, and it's an absolute pleasure to be back on today.
Oh, so I got my wires crossed. So we've obviously podcasted together, but I thought that was on the Monash Musculoskeletal Research Unit podcast.
It could have been.
I think we've done a couple there. I'll have to go. This is the 60th episode, so I'm starting to lose count of which one we're on. But anyway, you can go back and find Tim on lots of podcasts. You've got your series of podcast episodes yourself. So another lot of inspiration for me to start this podcast. So you can find you anywhere online. So how are you going, first of all?
Yeah, good. No, I'm excited for this conversation today. Lots going on at the moment, isn't there? But no, good to be able to just shut a few other things off and just talk shop for a bit with you today, Luke.
Yeah, we're recording this early November, so it's a busy time of the year for people in education and coordinating education in universities. So let's tell everyone a bit about you. Let's do a general introduction, background and interests.
Sure. Look, my primary role at the moment is with Torrens University, so that's my full-time work. So I'm there as the program director for our physical health suite of programs. So as you said, I've got a research interest in physical activity and persistent pain, and really anything that helps people to live more physically active lives, I'm really interested in. And I'm fortunate at Torrens that we've got a sort of suite of programs that fit into that space, from health and wellbeing to sports development, and some undergraduate programs in clinical myotherapy and akin. So that's my main role, and then I'm fortunate to be able to do a little bit of clinical practice as well, once a week at Complete Physio Exercise and Performance in Melbourne, where I really sort of get to apply my passion on a day-to-day basis. So I'm not just talking the talk at Torrens University, but also still walking the walk a little bit, seeing private practice patients every week. And then around that, I'm trying to complete my PhD in as you said, in sort of the tendon pain space, and really interested in that physical activity and load management and patient education as an underpinning, really sort of strategy to support musculoskeletal pain. So that's pretty much where I'm at the moment. And then a bit of sort of social media around things to try and pull it all together, and talking to people like yourselves to help disseminate some of that information.
I was going to say that the full singing, dancing, acting trio, the research, clinical and the education, but there's probably another step to that, which we're going to talk about today, which is the engagement. So we'll tell everyone, if everyone hasn't Googled you, doesn't know who you are, you've got a really successful YouTube channel where you're teaching health professionals various techniques. And at the conference, we were having a chat, and I was just astounded with some of the views on that channel. Go and look at the Periton Physio YouTube channel, and we've got 200 views on this and 50 views on that, and that's fine. It's people who have viewed it are very important. But what have you got? What's your number of views you've got on one of your videos?
It's slightly it's a very weird world to me, but I think we just hit just over 200 million views across that channel on the YouTube space. So that's I'm sure that's not all health professionals, but there's a range of people on YouTube and internet that are looking across those. So it's actually been on the back burner a bit, just in focus of all of those other things I was talking about. And really, my North Star at the moment is to try and get through this PhD. But I've certainly got intentions to come back to that YouTube space and develop that and grow that again once the PhD is out the way, and I can really focus on sort of disseminating knowledge as opposed to just creating new knowledge myself. So I'm looking forward to getting back to that. But it's yeah, that was the focus of mine a little while ago, and I certainly plan to come back to it.
You've obviously got the knack for that communication with that many engagements. It's fantastic. So, and now you've got a really big platform for what you do with your research and your clinical work and your teaching work as well to really engage with people. You and I had this conversation about Physio Foundations podcast, and your remark to me was the episodes are becoming obviously you work on your craft and they become more refined and they're improving. But one thing you're not doing is promoting it. And I said, guilty. I don't have the time and I haven't been promoting it at all. And so you gave me some really good tips in terms of engaging with people on various social media platforms. And I started the Physio Foundation summary, 3 to 5 minute reads on the episode. So that was all your idea. So we're going to credit Tim for that one.
Well, I'm glad that you took that on board, because I can see that if I listen to your first and early episodes compared to where you're at now, you've absolutely honed your craft and you're doing a fantastic job at developing that. But in my eyes, sort of, what's the point if no one's going to listen to that? And just to refocus you on sort of getting this great job out there to help more new graduates and undergraduates and health professionals across the spectrum actually listen to what you're doing is just a key part of it. And I don't think we can just do the first without sort of doing the latter. So well done for that.
There's an important push you gave me. So thanks. So that leads us nicely to the main topic here. So we're going to talk about finding your purpose. And let's just orientate people to how you and I got onto this topic. So we were at the Sports Medicine Australia conference at the final dinner of the conference, and we're relaxing and having a chat. And we started talking about how you found this amazing intersection and a space that really works for you in between your passions and your professional interests. Let's dive into that. Tell us about your purpose, and there's a Japanese word for this that you can pronounce because you've just spoken to a Japanese friend of yours and got the correct pronunciation. For you, go ahead and tell us.
The word is Ikigai, so I'll probably mispronounce that for the rest of this podcast, but that was how his Japanese friends sort of told me this morning. But really that's about an intersection of a reason for being. If we break that word down as we like to, we traditionally break a lot of Latin words down in what we do in anatomy, but in Japanese, the iki is to live and the gai is the reason. So a sort of reason to live. And that can be a little bit sort of esoterical and sort of a little bit sort of fluffy, but really it's about creating meaning for what we do. And I was actually just looking this morning to get the updated figures on the attrition rates out of our professions. And one of the ones I could find was on the APA website in their recent APA workforce analysis. So that's the Australian Physiotherapy Association. That was showing estimated 55 to 60% of people leaving the profession within 10 years of graduating. And that's a heartbreaking figure to see. So that clearly something's not working. And obviously that's complex and multifactorial. And there's many reasons as to why people might not find that, that this type of profession works for them. But for me, there's probably a significant amount of people that haven't found that sort of true passion because they're not finding that intersection between not just being an injury expert or a pain management specialist, but there's lots of those out there. I think we've got to intersect that with our own passions to really find the space that we want to work in and we need to develop in, and that we're going to have like genuine career success and passion for long term. So that's, for me, just very simply, years ago, I started to merge the world of considering myself as a sort of sports injury expert with my background and passion for sport and jiu-jitsu. And that just sort of found my space where my clinical practice is. And I think, as I've mentioned to you before, I've now pretty much, the limited clinical work I do just caters, my books are really open for jiu-jitsu athletes and jiu-jitsu practitioners around Melbourne. And for many people, that may sound like, is there enough work in that space? but it's really a mistake to think that the more specialized you get, the less opportunities you're going to get. I actually think it's the inverse of that. The more specialized you go into a space, the more opportunities there are for you. And you can specialize in the physical therapy and musculoskeletal pain and rehab worlds in working to a particular demographic or to a particular area of the body. So you might become a knee specialist, whereas other people become a jiu-jitsu rehabilitation specialist. And that's a space that's worked, well for me over time. And we can get more into that detail. But the Ikigai is a sort of Japanese concept, which really breaks that down. And it's a self-reflection tool, which I encourage any musculoskeletal health practitioner who perhaps isn't not sure if they've found their passion or their right space to sort of go through this and see if they can really revolutionize and the way that they practice to just get much better outcomes and to really stay in the game for longer.
Yeah, so good. Let's take everyone through the intersecting categories of the Ikigai.
So there's four pillars to the Ikigai. And the first one is thinking about what the world needs. So this can consider, and I would encourage anyone listening along to maybe just Google it so you can see a visual of this. It looks like a Venn diagram, 4 circles on the Venn diagram, and then there's 4 pillars within that. And really you're finding your reason for being it sits in the center of this diagram. So the first one is about what the world needs. So considering how your actions or what you do can benefit society or fulfill a larger purpose. And so that might be the larger impact of rehabilitation or efforts on society, and really to address that societal need. We know that pain is, a third of, or 20% of the Australian population has a persistent pain condition. And so we know that there's obviously a societal need there. And so helping patients to return to functionality, improving quality of life, things like that might be what the world needs or your mission. The second of the pillar is about what you're good at. So what your vocation is. So the inherent skills that make a good practitioner, and that might be around interpersonal skills or technical skills that you probably haven't got past through your degree, or you wouldn't be in the profession if you weren't good at those skills. And I mean, that's your bread and butter, Luke. Physio Foundations is all about those the fundamental skills of what makes a good practitioner. So you can probably help me out there and really, you'll have an in-depth understanding of all of those different things that what makes a good practitioner or rehabilitation expert. The third one is around sort of what you love, and this is where your passion comes in. So what do you actually feel enthusiastic about doing? And that might be related to the rehabilitation space, but it might not be. It could be your sort of what's perceived as an unrelated interest, and we can then look at how those things might merge later on. So is it the love for sort of helping patients and seeing people recover, but really what are the personal areas that you're interested in, whether that's sports or just what just sort of gets you up in the morning? What do you get excited about? And that's that area of what you love. And then the fourth one focuses really on the practical aspects of life, ensuring that your passions and skills can actually provide for your needs. So it's what you can be paid for, or what your profession might be. So is that making a livelihood from private practice, ensuring that you've got enough stability to be able to meet your needs while you're doing what you love? And so addressing the real world challenges in the rehabilitation space has a job market. And so they're really the 4 areas. And then we can talk about the intersection between those as well, if we want them to get further deeper into it. And I'd encourage people to have a look at that. So, the intersection between then the passion for what you love and then the mission or what the world needs is really where you get the excitement of making that real difference. But if we only look at those, you're going to get that kind of fullness, but you're not going to be able to look at the wealth and the reality of working in that profession. So we need to make sure that we're not just looking at any one of these sections, but you're looking at bringing these together. And for me, that was a bit of a personal journey of mapping this out. And that probably a few years ago, 5 years ago, I was moving away from clinical practice into more sort of research and more into the education side of things. But doing this process actually helped me find my space that I'm really passionate about and love. And now I'm back into the clinical practice with, and I don't see myself moving away from it. So, yeah, it takes a little bit of time to map out, and I'm happy to share kind of each of those areas if you think it'd be helpful for the listeners to how it resonated with me, and then perhaps we can look at the Physio Foundations podcast and how I can see your passions have come together in knowledge dissemination and in helping people to understand this stuff.
I'd love to do that. We can workshop our own personal intersections between the passion and vocation and practical aspects. And then hopefully this is really a practical exercise, and hopefully others are out there doing this as well and have the pen and paper out as I do right now. I really, before we do that, I really like how you anchored down the rationale for doing this yourself and for others to do this to the attrition rate from the professions. If you think about how much money goes into personally yourself and from governments, to training health professionals, and you've got a 50 to 55% attrition rate, that's a serious problem. And why that is multifactorial, but it's a question you should be asking yourself as well. We all go through a period of time in our careers, probably multiple periods of time, where you doubt what you're doing and you think, I'm not sure about this. Is this for me? And this is the exercise to do when you're at that point in time. So let's workshop through you first. So not just to recap, what the world needs.
And just before I come on to that, because I just reflecting on your point, and I think we can do that we can always do self-reflection as at a point when we are, a bit lost or a bit unsure about whether we're in the right space. But I think we can also take this approach really proactively. So at the point of, I've just starting my undergraduate degree, or I'm coming towards the end of my graduate degree, where do I want to be in 5 years' time? And how can I make that vision a reality as best as possible? So we can take a proactive approach of doing this prior to graduation, and really then set that 5-year vision, 5-year goal, 10-year goal based on a process of self-reflection and of where you want to be. And then you take ownership of that mission, and you take ownership of how you develop as a new early career practitioner to make sure that you reduce the risk of, or the chances of, you being one of those statistics that falls out of the profession in 5 or 10 years' time.
That's such an important point, rather than waiting for you to reach this crisis point. And it's something that, look, I've talked on the podcast with many guests about the role of mentoring in your career as well. And, having exercises to do as a part of that mentoring process. Sometimes mentoring is just having somebody who's prepared to listen to you, but all the way through to really proactive approaches as well. So let's work through timtrevail.com. That is your website. That's funny. Tim Trevail. And let's work through your 4 categories: what the world needs, what you're good at, what you love or your passion, and the practical aspects, how you can pay the bills, how you can get the skills to pay the bills, to quote the Beastie Boys. So let's work through you.
Well, it's the first one around what the world needs for me. So we're not leaving anything sort of by chance. We're figuring out what the world sort of generally needs. And for me, I knew that the world needs high value care for sports related injuries, because high value care can improve quality of life. It keeps people doing the activities that they want to do. And that in turn clearly has an improvement on quality of life. And it's always been a passion of mine, and it's been one of those North Stars to help people lead more physically active lives. And I think that's what the world needs. If we get more deep into that, we can think about the burden of chronic disease and the issues with physical activity and the issues with growing amounts of the burden of persistent pain around the world, particularly in the Western societies. The world clearly needs high value care for musculoskeletal pain and for sports related injuries, which starts to connect to my passion. So then what am I good at? So I like to work with people, and I like to help people to understand their pain and injury, but it's not so much what I like to do. It's what I feel I'm good at. I think I'm good at helping people understand their pain and how it relates to the life that they're living and the challenges that they're having around their lives. And I think I'm good at getting people to be more physically active, whether that's related to a specific injury or generally in their lives, considering things like, physical activity levels and are we meeting those requirements. So I think the interpersonal skills and the problem solving skills that underpin that is an area that I believe I'm good at. So then it's about, how do I connect that? That is what I used to do. I think those two things are what I used to do. I used to work with generally sporty people, but not always sporty people. And I used to help them be a bit more physically active. But I wasn't really connecting that with things that I love. And when we start to be a little bit more selfish, we can specialize and find this sort of reason for being, or Ikigai. So what I love, and one of the things I love, is martial arts and jiu-jitsu. So, Brazilian jiu-jitsu practitioner for about 10, 12 years, a bit of judo before that. And I have a black belt in Brazilian jiu-jitsu now. And it's been a passion for many years. So I spend, a number of hours per week continuing to train that and hone that. And we know that our own happiness will come from a combination of competence, autonomy, creativity, and impact in areas that we enjoy doing. And for me, that's jiu-jitsu. So then starting to merge those worlds a bit more, and what I can be paid for is the reality of the last one. And I know, but I've seen it, and I know that people will pay to be able to return to a sport quicker with confidence in a reduced likelihood of re-injury or injury, and to understand their pain and injury. So, for me, when I've drawn those things together, that sits as a specialist in musculoskeletal pain and rehabilitation for jiu-jitsu practitioners, to help them understand their pain and injury, reduce their chance of re-injury, and spend more time doing the things that they love to do. And really, that's where my clinical practice is sat now. That's the reflective process that I took to get to that point. And then it's a case of, right, we can probably talk next steps is about making that a reality into your clinical practice, which is obviously has to happen after we've done this stage of reflection, and we've got a goal, we've got an area or a reason for how we think we could bring passion to our own clinical practice.
That's fantastic, Tim. Can your Venn diagram get out of balance? For example, so I'm trying to think of the book where I read this, and I'll put it in the show notes. I'll look it up and put it in there if you're interested. There's a book, the whole thesis of the book is about the passion hypothesis and how that is overrated and oversold, and that you need more than passion for a career. For example, as you've just articulated really clearly, you need, to pitch what you're doing with what the world needs and what you're good at and the practical aspects as well, so you can get paid for it. And if you have passion in there, that's a bonus. And I hope I haven't, and I'll put the book in the show notes so we can have a read of that yourself and see if you agree with my summary. Well, the general question is, when can this get out of balance? Has that been out of balance for you? For example, for the first few years of your career, was it more you were focusing on your needs and what you're good at, and you didn't have the passion of bringing in the BJJ training into your practice, for example? Were things out of balance at any stage?
I think I've been really fortunate that I haven't relied for a while now on clinical practice as my sole sort of source of income, because I've been involved in education and because I've sort of been in research more recently. I've probably been able to be a little bit more playful with each of these areas. So I've been able to dial up a little bit more of what I love without having to worry too much about what I can be paid for. But mapping this out really did help me to understand that there is a niche there, and actually, moving towards that, because it might be that traditionally I had my books open to everyone, and because I knew I could be paid for that, and we know that a standard rehab specialist will be open to anyone, and you could be paid for that. And then really sort of growing the brand, growing the expertise in one specific space allowed me to sort of slowly move towards that. It's not like I suddenly sort of switched the tap off on one thing and on off to a certain demographic and onto another. It was a bit of a sort of drip feed of an increase in a certain area, and then that turned into a sort of the only area that I now work in, which really sort of, it took me a while to find that Ikigai. But I absolutely agree, if you spend too long thinking about what you're good at without actually what the world needs, then you're going to have a mismatch there, or too much of what you love without actually understanding whether you can be paid for it. I think it's crucial that you're considering all four of these to make sure that you can find like something that actually has a grounding in reality and a grounding in what you can actually sort of do.
Yeah. It takes time to develop, which is an important point you made earlier about if we're leaving the profession after a short number of years. How long have you been working in healthcare?
So I graduated in 2007 in the UK. So I've always been in some form of private practice at some point, or working for sort of sports teams. So I've always been in clinical practice, but for majority of that time, I've been in and out of different educational roles as well. So most of the time, it's been part-time clinical practice alongside educational leadership roles more recently.
So it takes time. And if you're listening to this and you're a student or a new grad, and you haven't found, or you can't clearly define your four categories doing this exercise, working along here with Tim and doing this exercise, that seems to me that's pretty normal, something that takes time to develop. And perhaps this is a moment to have hope that there may be more to it, and there may be more passion that comes into your view of your career. Or if you're driven by passion, but you're not making a lot of money, there may be more practical aspects that you're working on and you can develop, for example, in the way you set up your career. I found the book, Tim. It's called They're So Good They Can't Ignore You by Cal Newport. And and that rule number one, I just found a book summary online. Don't concern yourself with passion.
Yeah,
I won't take the book out of context because there's quite a lot in it, but it is a common thing that I see where people are searching for their passion, and if they don't find it instantly, they're leaving things. For example, it takes the thesis of this book was that if you go and do develop the things that you're good at, you can find your passion because it's fun to do things that you're good at.
Yeah, I mean, I would have to go away and read that book, but I'm not sure if I would agree with the sort of premise of that, because I think we probably need to find a middle ground there. And it's probably a bit of a boomer complaint that all of the Gen Z are just focusing on their passions and spending too much time on TikTok and not actually just focusing on what they're good at. And we know, the working on things that we are good at is beneficial, but perhaps we can find our passion through that, but I'd suggest a lot of people need to find a middle ground there. I think you can find both, and I think there's no reason why you can't find things you're good at, but also connected to things that you do love doing and you have that passion for. I don't think it's a binary one or the other. I think we can find a space where we intersect and we connect the two of those things, and that's what I advocate for any of my students and people in the profession.
How soon is too soon for specialising, do you think? So if we're talking to students and new grads or anyone else who's listening to this, but if we talk to that demographic for a moment, and so you're talking about specialising with a specific population, with Brazilian Jiu-Jitsu athletes, or it could be anyone's example of what they're specialising in. Do you think there's something to be said for working broadly before specialising? Or is it very individual, depends on your luck and circumstance?
I would think that there probably is a scope for generalization. If I think about my clinical background, I worked in rugby union for about 12 years. And so I absolutely loved that sport for everything that it brought to my clinical experience, from the acute to the persistent chronic conditions to every sort of fracture and dislocation under the sun over that period, and managing all of those things acutely, right back to that rehab space. So, I think I've learned a lot of that and being able to bring that into an area like jiu-jitsu. So specializing in an area is so powerful for people on the receiving end of that. So if you're an athlete and you work, you have a passion for a certain sport, and you can talk the same language as someone who is doing that activity or that sport, that's a completely different environment for you to go in for care. So to be able to actually go in, you've got a painful knee or a painful back, to be able to actually talk the language and know that the person on the other end has a shared passion for that. I think the clinical outcomes are much stronger because of that, because the buy-in is better, and we know that that clinical relationship between patient and practitioner is a really important factor in terms of the success rates and sort of long-term outcomes. And so when we can sort of find a shared passion for areas like that, I think that's really important. And I think that there's no reason that we can't start to consider our specialisation and plan that out over time. I was talked about a 5-year sort of goal to start with. So for an undergraduate, I think it's absolutely okay to think about specialising in 5 years' time and slowly work your way towards that. So this is about finding that North Star, where you want to be long term. It doesn't necessarily mean that we want to go out and specialise or need to specialise straight away and miss out on all of the broader learnings that we might get working with different populations and working in hospitals or whatever that might be. But this is about making sure that we find our long term, so we can be in this industry for 20, 30, 40, 50, 60 years, not just in it for the short term and get out and not sure what to do there.
That's another really good really important point, because so often we talk about the decision to do something now, immediately, and it doesn't have to happen right now. Planning things in the future around your interests is something that can be really motivating and fun. You can think, well, I'm not going to give up now. I have things that I want to do.
The other thing is when we say, are we going to specialize? It's what do we mean by a specialist? Because yes, we have, APA titled, or other professions might have specialists that you need a certain master's qualification for, or you need a postgraduate qual to call yourself something or to specialize. But what else does that mean? For me, that's someone who just puts themselves out there and talks about it a lot, right? What makes me a rehabilitation specialist in a certain area is the fact that I just started talking about that a lot on Instagram and online in social spaces, and people get attracted to you not because you've got a master's qualification or a PhD or whatever else. They get attracted to you because you are sharing sensible, evidence-informed information online to a community that's underserviced and underrepresented. So I found it's my passion and my job to be able to relate evidence-based practice to a population where that doesn't have much research in, or even if there is a lot of research in that area, make it make sense to that population. And by doing that, by disseminating that information, you're becoming a specialist, you're becoming a go-to person in that area. You're understanding the research, by keeping up with the research, you're translating that into patient-friendly, athlete-friendly information, and that's part of your own professional development, and that's helping you become the specialist that you want to be. So you set your own, you decide what you're a specialist in, not someone else. You set up your Instagram, social media pages, you set up your timtrevail.coms, you define the narrative for the specialist that you want to be, and obviously within your scope of practice, but go for it. It's no one's holding you back. It's up to you to find your passion and to shoot for it.
There's so much good information out there. Of course, we always talk about the poor, unreliable sources of information on the internet, and you should be an educated consumer of research and information, of course, but there's so much good information out there on the internet that people can go to that you almost risk being invisible despite being useful and being spot on with the things you put out there. So I'm an advocate for starting and talking to the people who are in your group and not necessarily measuring the size of the group. We talked about your 200 million YouTube views, and that's fantastic. And then there's a much smaller niche audience for the Physio Foundations podcast, a lot of whom will contact me and I'll meet and we'll talk to and have then come on as guests on the episodes. And to me, that's really important as well. It's not so much about you can't measure it in terms of views. But as a segue, talk to us about new grads and students in the early days when they still feel that dreaded imposter syndrome, if we still talk about that, if that's still a thing. And they think, well, I don't know enough to get out there. I don't know enough yet to put myself out there and engage and start an Instagram, for example, or a website, or even to go to conferences and talk to people, talk them into it. You did it.
I did. And the first thing to note is that if you've got imposter syndrome now, you can rest assured that will never go away, no matter how many views you get on YouTube or how many people you have, connections you have on your Instagram, whatever else. That will certainly never go away. And for me, it hasn't. But we've just got to understand and live in that bit of discomfort. We talk to our patients about sort of living in, or talk to our undergrads about living in that uncomfortable space and getting comfortable with being a bit uncomfortable, and putting yourself out there anyway. Like, what's the worst that could happen if you put yourself out there a bit more? And if you ask yourself that question and you can live with the answer, then why not do it? Yeah, because that is the worst that can happen. And what's the best that can happen? You can find a niche, you can find an expert area, you can be the go-to for a certain area, and you can find a passion and a job that you actually love to do. And if you can deal with the worst and you want to give yourself a shot or an opportunity at the best of those outcomes, then give it a crack.
Particularly if what you're doing is really well-meaning, well-intentioned, ethical, useful for the people who are listening to it. I haven't come up against, I've only had positive reactions for it. I'm sure if you have a very large, diverse, I nearly said fan base, or let's say followers, for example, like you probably get a few people disagreeing for the sake of disagreeing, but it's really been a very positive experience for me.
Yeah, and looking at stuff you do, it just comes across very authentic and very genuine. And even if you see stuff online that you don't necessarily agree with, but they're coming across as genuine and authentic, no one shoots you down for that stuff. Someone might politely disagree, but it's the people that, are the loud, shouty voices on the internet that attract the people that, want to disagree with you. And I don't get that much, but I do see it out there. And I do think that's about how you present. And the more abrasive you want to be with putting things out there, the more likely you're going to attract that type of abrasiveness back and sort of shouty things on the internet. But I'm not interested in any of those type of shouty arguments on the internet. I'm happy to kind of, say something, make a comment and move, politely and move on. Perhaps provide a little bit of evidence and move on. I've got no interest or time to be able to have arguments on the internet. And, some people do, and that's fine, but it's not the space I want to live in.
Yeah, for sure. Well, when you and I were training, for me, the internet didn't exist. It was in its infancy, perhaps. There really wasn't any exemplars of people doing anything at all. So I noticed from talking to our students and new grads, there's a lot of them consume a lot of online content in alternate forms, everything from your Instagram to podcasts and blogs and everything else. A lot of good YouTube channels that show clinical skills, for example. So they're quite on top of various resources and they're using it. And also the dreaded TikTok. So I've recently found out that there's some good stuff on TikTok. I was yet to be proven. But all I've heard of TikTok is that it keeps you awake till 4 a.m, scrolling endless 7-second videos of people dancing. But apparently there's some short form video content all over the internet that the students are using, and it's helping them consolidate what they're hearing in the long form lectures and in the textbooks, for example. You and I never had that, and we're sort of trailblazing that, at least from our perspective. And then when they're at our stage, our students are going to have all this foundation of understanding of what works and what doesn't work. Imagine what they're going to be doing. So I guess the question is, when do they transition from being just a pure consumer of it to someone who's producing it themselves? Do you have to? Can you go through your whole career and never produce any content? Is another question. I don't know if we need to answer it or not, but it's something I think about.
It's an interesting question. And I suppose it depends how much. I think we're living in a world where it's difficult to be able to become an industry recognized expert or patient recognized expert in an area without having some form of presence on social media. So yes, we may get that expertise through through significant amount of researchers, and we all know some professors who produce huge amounts of research who develop a referral network from doctors and from other referral spaces and become a specialist without a social media presence. But without having that background, I think it's tough. And so I would encourage people to move from purely a consumer to a producer of some of that content. It doesn't need to be lots. It doesn't need to take up all of your time. And it doesn't even need to take you too far out your comfort zone. There's so many different ways of doing things. If you don't want to talk to camera, you don't have to. You can produce infographics. You can produce, single slides or photos with some, content associated to that's going to be of value. So just think about what's the perfect patient that you would like to see, and what questions might they have. And if you're stuck about where to start with content, think of a question that you've been asked from a patient and answer it. Think of another question and answer it, and start like that. And you're going to suddenly come up with quite a bit of content in whatever form that suits you. And you can start moving towards your Ikigai or your purpose and an area you want to live in.
Gold. There's so much in that. And there's a marketing element to that as well. If we're talking to people in the private industry, clinicians who are marketing themselves, there's a huge element to it. All right, I've been trying to avoid my least favorite topic, which is talking about myself. But let's workshop Physio Foundations.
Because I've seen you.
Let's do it.
With you, I've seen you go through a process. So first of all, with what you're doing, what does the world need?
So it's a good question. The world needs a lot. So I think if we're talking about what I'm doing here in Physio Foundations,
let's focus on that, I reckon.
Yeah, it's probably more demographic. Yeah. So a lot of the content that I see is focused on, if you think about everything as a pyramid of knowledge and skills as a pyramid, and you've got the foundation of knowledge of skills that we sort of take for granted often, and then the top of the pyramid is the stuff you might talk about or hear about at professional development courses or conferences. And it's this exciting new findings and the things that might make you different from other people. And then sometimes, the boring old interpersonal and communication skills and the clinical skills that you just assume that you should be good at aren't talked about as much. And I think from my perspective as a new grad when I was coming out, and from the perspective of a lot of the students I talk to and our new grads that I've spoken to, they sort of value talking about those foundational skills because they're still working their way through them. They're still developing them. So being open about that and giving everybody an opportunity to work on those foundational knowledge and skills is to me an important need. And I think the podcast it's such a natural format as well. You can be quite honest. It's not like a YouTube video or a conference presentation or an infographic where everything is planned. You don't really know where it's going to go half of the time. And it's an opportunity to talk through and be honest as well. So honesty is a part of that. So that's a need.
So what the world, just to reflect that back, let's keep it down to sort of refine it down to one sentence. Honest conversations about key foundational principles that make an effective physiotherapist. Is that what I'm hearing? Yeah.
You can take over the Physio Foundations podcast.
No, I'm just going to reflect back all the great things you're saying into one little bit. And that's great. So
you've summarized it for me.
I know that you're not someone who loves to do this, but you've just got to suck it up. What are you good at, Luke?
What am I good at? Interpersonal skills you've mentioned. I like talking to people. I think I'm good at talking and listening.
You're good at talking and listening.
That's why I started the podcast.
That sounds like a good space to be doing that then.
Yeah, everyone can listen to me failing at this. And I hope when you do it, it's hard as well.
Certainly not. And I know that you're good at that. And as I said, from where you were to where you are now, you're only refining that, and you're even far better now than even you were, a year ago at doing this. So
look, I think I have a clinical master's degree that I've also brought in on top of my undergraduate degree, and then PhD, which is the apprenticeship in research. So that's your entry level to get into an academic teaching and research position. So I see one thing that I bring in is postgraduate clinical training rather than just having research training and then going into a clinical education role. And I've also done a lot of professional development as well, lots of clinical conferences. So bringing in a broad range of knowledge. I can have a conversation with Prue Morgan, who's our head of department, about neurophysio, and we'll talk about musculoskeletal physiotherapy, for example, and can go between a broad range of topics. I think that can be a weakness in terms of niching down and finding one thing that you're good at, but being able to talk to a range of people about a range of topics and draw threads together is something that I'm good at.
Let's talk about your passion then. What do you love?
I love what we're doing now. So I'm in a teaching research position. So I've split my time between admin and teaching related administration, teaching, research, and what we call service or engagement. So which is what we're doing now. And if I could plan the perfect week, I'd be doing exactly what we're doing now. So working through and teaching. So I really, really enjoy helping people develop their professional and personal skills and knowledge, and watching them grow through the calendar year as they go through the first year of their undergraduate training. That's what gets me out of bed in the morning. I'm not saying that I don't like research. I'm passionate about research as well. We have the Monash Musculoskeletal Research Unit, and within that role, one of my passions is actually getting other people to progress with their PhDs as a PhD supervisor, for example. So a lot of my passion is in education and mentoring.
And then the last part is about what you can be paid for. And you just touched on it as being like a percentage of your service within your Monash role. But how do you sort of see this fitting into what you can be paid for?
Before I had an academic role, a lot of the things that I do as a part of that role I was doing anyway. An example is reviewing journal articles. It's probably well known that the big journals don't pay their reviewers, and you go and you review those for free, and then the journal makes their money. It's a big concern. It's a big issue in the industry. I was doing that before I got into an academic role. I was doing clinical professional development. I was working with people on research projects, getting involved in sessional teaching. So I was doing a number of things that are actually now part of my paid role. So to me, working in the university gives me an opportunity to bring all of that together and still maintain that contact with the clinical practice that I used to do. So for 10 years, I was a pure clinician. And then I gradually moved into academia through sessional teaching, research assistant work, then through my PhD. And being able to teach clinically means I can maintain that connection with the clinical work that I used to do. But under the umbrella of a teaching research academics, you can get paid for all the different disparate things that you do. So I think I've got that one covered. Love my job and love the people I work with as well. It's a great place to be with, to work at. So
Before we mentioned there was two, we mentioned that there was two reasons as to why, or two times you might be completing this types of self-reflection process. We talked about proactively before you're going to have any sort of your problems, or even, and then we talked secondly when you're in perhaps a little bit of despair or questioning whether you're in the right career path. But I think the third one is to help make sure that you are on the right path. So for anyone just to stop and reflect and to go through this process themselves, as you've just done, which should help to reignite that passion, or just say, well, I am on the right journey. I am in the right place for me right now. I am doing this, and this is something that I should continue to do. So it's not about starting to do something or stopping to do something. It's actually just reaffirming that we are in the right place. We're doing things that are suited to my passions and my why and my North Star or my Ikigai, however you want to talk about it. And for me, listening back to your passion, and that this podcast is something that links in for you that works well, is a third reason. And for everyone else listening on this, will be in one of those positions. They're either thinking about their future, they're either a little bit concerned about whether they're in the right place, or they're feeling good about their profession and they've got a chance to check in and give themselves the next 5 years worth of passion, that they're in the right place, they're doing the right thing, that it works for them. And it's just a bit of a sense check. Might help us course correct a little bit in one direction or another, or might just go, right, I'm in the right space, let's keep going.
you led me through that exercise so nicely, and I let it happen. But you got this. The listeners got to hear me being a bit uncomfortable at times doing that.
Yeah, and I appreciate you.
I don't really get uncomfortable
I
on
didn't
the
give you any
podcast.
forewarning on that. I appreciate you jumping in, and people who have listened to your podcast will understand that passion, and hopefully then go and do this type of exercise themselves.
Mm. So where to from here? So I guess for our audience, if you've worked through that exercise, I think Tim's given you some really nice guidance there on how you can use this exercise to not just course correct, but also to affirm what you're doing as well. I thought that was a really good point. And before that, we spent a bunch of time talking about the potential for students and new grads to become those thought leaders in their area, and not necessarily being constrained to the boundaries of a degree that you have that says that you're a specialist in this area, or a series of research articles. I mean, those things are important as well. We're not discounting them, but someone like you, Tim, you've gone out there into the online world, and almost effortlessly, I know there's a lot of effort there, but you seem to have quite naturally built up your brand, your personal brand. But it's not actually about you. I mean, your website's called timtrevail.com, but it's about how you can help health professionals and patients. All of your social media, obviously you're the face of it, but what you're trying to do is help people manage their injuries and return to jiu-jitsu faster, for example. So you're clearly enjoying what you're doing, but you've got service in mind as well. You've got a mission, a North Star, as you put it, to really help people through your research and through your practice. So, I mean, hopefully conversations like this do something to help with that awful attrition rate that you mentioned at the start of the episode. That's
it is a scary stat, and I said the physiotherapy one, but I'm sure it's the same in similar in myotherapy and any other profession. So it's really something that, I mean, at Torrens we've always taken like a strength-based approach to learning, and that's what we focus on. And I think this is really, it connects well with that strength-based approach, as you said. That's the strength-based, what you're good at, as well as linking back to that sort of passion and making sure you tie those things together. So yeah, you can see it certainly. I appreciate you feeding that back, Luke, but it certainly wasn't effortless
that was the wrong word.
Dome and and whether things are right. And I'm still scared at times to sit in front of cameras and talk to things, and just that's still a work in progress for me to develop all of those things. But people can see an example. It's only fairly small scale, but I think it's I retitled that, just rebranded it slightly. It's Black Belt Rehab on Instagram. If people are sort of looking for the type of things that, how I start to bring that together, and really through the power of that Instagram, that helped me to change my clinical practice to just working in areas that I'm interested in as a result of this type of reflection exercise. The reflections is great in itself, but it's taking that next step to bring that reflection to a reality to then actually change the way you practice. And for me now, I can see myself being in clinical practice, and I do some face-to-face stuff in Melbourne, and I offer now sort of specialist ACL jiu-jitsu services are like online via telehealth. So I've just been to someone yesterday from Adelaide, and I've got someone from London tomorrow, on Saturday morning I'm going to be speaking to, just to help that sort of transition and really relate that, what they're struggling with to the sport that they love, and finding that intersection has allowed me to specialize in that space. So you can see the way I've tried to bring that together. The example was probably via sort of Instagram there, and the other bits are, it's only about providing value to people. And I think that's where the value, that comes, and the following comes, and the expertise is really going through that process of what the world needs. And then you provide the value and turn that into a reality for you.
That's brilliant, Tim. So people can find you at Black Belt Rehab and have an example. So it's probably, obviously people may be following you already. It's a good idea to have a look at Tim's model of what he's been doing here, and you can sort of see what he's been talking about for yourself. And hopefully that's provided some motivation for our listeners for finding whatever part of their, can you help me with the word? I'm going to say it wrong.
Ikigai.
Ikigai. That they need. that will help them stay in the profession for a long time. Because we're biased. We're highly passionate about what we do. We believe in the mission and the project. We believe in what we're doing is helping people. And now in the part of my career I'm in, I really passionately believe in helping students become the best they can be so they can help people. I think it matters. But we want our patients and we want our students to be in this for the long haul. And there's probably more to it than you think, whatever time you're in right now. There's a lot of good to be found in the future. So that's some good inspiration for everyone. So thanks very much, Tim, for a great discussion and for making me feel uncomfortable and helping me develop my or affirm what I'm doing here. I really appreciated that. It's good.
Good pleasure, Luke. Thanks for having me on.
Now, just quickly before we go, jiu-jitsu, just tell us a little bit. You are a black belt. How quickly would you destroy me so I'm not a jiu-jitsu player. If I was a troublemaker of some sort and coming around causing some disturbances, how quickly could you submit me with your skills? And maybe I need to train.
Look, I think if you want an answer to that question, get down to any jiu-jitsu and give yourself sort of 30 seconds to a minute of trying not to get submitted and see how that goes for you. So, look,
a good answer. Yeah, it's a sport. Is it a martial art or a sport?
Look, it's a bit of a grey space, I suppose. It's traditionally a martial art, and now it's sort of very sort of sport. I'd call it a sport really, rather than a sort of traditional martial art. It's in terms of the way that it's been developing in recent years. So it's becoming more professional, which is good for people like me who can then find a space that people will find more of a more sort of. When we move towards a sport, the more people we have that are involved in it and doing it, and are really kind of looking for a way to be more professional and to be more athletic and find those qualities that we can help people with.
And it's a sport, martial art, that has a real connection to the person's personality and personal development. And so, my understanding is that if you're not humble, you will be humbled very quickly.
That's probably fair to say.
Yeah, so sounds like I need to join so many other people I know and train, but that's a conversation for another episode. But look, I got a lot out of that. Thanks very much, Tim, for a great conversation. I hope listeners did as well. Of course, if you want to follow us, you can look in the show notes and you can follow Susanna and I at Periton Physio. You can find Tim at Black Belt Rehab and timtrevail.com. Any other handles?
Just my surname Trevail on Twitter. If people are on there, but you'll find me.
Yeah, jump on there and join the conversation. But we'll have to do it again. So thanks very much, Tim.
Anyone wants to reach out and talk through sort of just finding this space for them, I'm always happy working with people and helping them find their passion in this space. So yeah, please reach out, and I'm happy to have a chat anytime.
Fantastic. All right, thanks, Tim. So until next time, this is Tim Trevail and Luke Periton wishing you all the very best with your studying, professional development and lifelong learning.